Dr. Andy here today. Today I want to revisit the age-old question of ice versus heat, okay? So it's probably the number one most common question I am asked in the office is, hey doc, as the patient is finishing up for the day, is this something I should use ice for? Is this something I should use heat for? And honestly, it really kind of depends. And I kind of feel like the answer has kind of gotten muddled recently, so I would like to kind of readdress this because everything that we were taught in the past isn't quite the same, right? Or isn't quite right, okay? And let's start with ice, okay? So this is truly the one that kind of needs a little bit of an update because for the longest time we were thinking that ice is great for an acute injury and you can use it for maybe a couple of days, about 3 days, and after that it's not really as useful and we should switch to heat, okay? We need to revisit that, all right? Because ice actually limits the healing process, okay? So ice is extremely useful because it limits swelling and it limits pain. So absolutely, if you have a new injury, ice can be helpful for decreasing pain and limiting maybe a secondary injury or limiting swelling, okay? However, we need to address the fact that a recent study has basically been shown that you do not want to use it after 6 hours, okay? And this is especially true for any kind of injury, but specifically an acute injury, okay? So if you have a sprain, a strain, some kind of acute trauma like a car accident, ice is helpful, but it's only helpful for about the first 6 hours after the injury, okay, after the car accident. After that, you're actually slowing down the healing process and you're doing more harm than good, okay? So how long should you put ice on for? Usually the secret is about, or the secret sauce is about 10 to 20 minutes, okay? So once you kind of start to go numb, that is when you start taking the ice off. That can happen around, 10, 15, 20 minutes after applying ice. You want to be careful. You want to make sure you don't give yourself any kind of burns. So you actually freeze yourself or freeze tissues. So you want to make sure that, maybe there's a towel in between or a t-shirt or something so that the ice does not damage any tissue, okay? So ice is extremely useful for migraine headaches. And it's extremely useful for an acute traumatic injury like a sprain, strain, but only for the first 6 hours. After that, I don't want you using ice anymore, okay? Instead, heat becomes a really, really good option. What does heat do? Heat also helps kill pain, okay? But more importantly, what heat does is it increases blood flow. And for the most part, if we're talking musculoskeletal injuries, I want you to think that blood flow is good. Blood flow is healing. That is true for all of our chronic problems, all right? But then also our acute ones after those first 6 hours. So first 6 hours, you use some ice. After that, you switch to heat. And still, it's the same truth in terms of you want to leave it on there for about 15, 20 minutes at a time, okay? You don't want to leave heat on for hours and hours. And you certainly don't want to fall asleep on a heating pad or something like that, okay? So hopefully that kind of sheds some new light on what do we do? Do we ice it or do we heat it? If you have a new injury and it's kind of a traumatic injury like a sprain, strain or something like that, yes, you can ice it, but only in the first 6 hours. And then after that, anything, heat becomes the better option, okay? So if you've got an injury that's been bothering you for years, heat still is the better option, okay? All right, hopefully this answers your questions on ice versus heat. If you have any more questions, send them my way. And always remember to live with passion, not pain.